morning, sir. I'm going to perform assessment of administering oxygen via nasal cannula. Purposes, we have to deliver low to moderate levels of oxygen to relieve hypoxia. We have to allow uninterrupted delivery of oxygen while the client ingests food or fluids. In preparation assessment, we have to check for skin and mucous membrane color, breathing patterns, chest movement, chest walls configurations, lung sounds audible by auscultating the chest and by ear, presence of clinical signs or of hypoxia, anxiety, decreased level of consciousness, inability to concentrate, fatigue, dizziness, cardiac dysrhythmias, pallor, or cyanosis or dyspnea. And then auscultating the lungs, and planning. We have to assemble and prepare the equipments, appropriate oxygen delivery system, this one, and we have also nasal cannula, and we have simple oxygen mask, concentrated 40% to 80%, and then oxygen source. We have the flow meter and no smoking sign, and humidifier, distilled water for high flow therapy, and we have, this is the humidifier, and we have also our tape. We have to review the chart of the physician order for oxygen to ensure that it includes a method of delivery, flow rates, titration orders, identity, and client. We have to check the client order, and then we have to wash our hands to prevent any infection control procedure by using soap or alcohol. And then we have to explain the procedure to the client. Sir, we have to insert nasal cannula, oxygen therapy to relieve for difficulty of breathing. And then we have to assess the client for semi-Fowler position if the client tolerate. we have to insert flow meter into the wall outlet oxygen tank. This is the flow meter. And then we have to attach the tubing to the nozzle of the flow meter. Attach tubing, attach oxygen tubing to humidifier if using a high O2 flow. And we have the humidifier. And this one. And then we have to attach the tubing to the humidifier. You have to attach the tubing to the humidifier. This one. This. And then we have to check the oxygen if flowing through the tubing by placing the nearest of the nasal cannula on your wrist or near your skin, just to know if the oxygen or the humidifier is flowing. And then hold the nasal cannula properly, position with the prongs and curving downward. Like that. And place the cannula prongs into the nares. And then we have to wrap the tubing over the over and behind the ears. Wrap the gauze at the ear beneath the tubing, and necessary prongs dislodge from nares replace promptly. Then we have to go to evaluation. We have to assess for proper functioning of the equipment and observe client's initial response to the therapy. And then monitor conscious therapy for assessing For pressure areas of the skin and ears every 2 hours, and rechecking flow rates every 4 to 8 hours. We have to perform follow-up based on findings that deviate for the expected or normal for the client, and relate findings to the previous data if available. We have recording and reporting. We have to record and report all patients' information of procedures, and records pre-procedures and post-procedures vital signs, and document evaluations of patient or caregiver learnings.